Hi, this is Dr. Kwun calling from the surgery. May I confirm your name and date of birth, please?
Yes, I'm Sarah Sloan, and date of birth 12th of March 1994.
Thank you. How can I help, Sarah?
Well, so I think I might be pregnant. About 9 weeks. I've been having morning sickness, and you know it wasn't planned. I didn't plan the pregnancy. I already have 2 children, and I really don't think that I can manage another child at this point in my life. So I'd like to discuss some options. I don't want to keep it.
I see. Well, thank you for getting in touch. We can certainly discuss what treatment options are available if you wish to have a termination of the pregnancy. So, may I check with you, has this decision come after discussion with your partner?
Well, sorry, is this confidential? Because I don't want any of this to get out. You won't tell anyone about what I say, right?
So everything we discussed today will be kept confidential unless I'm legally obliged to disclose any information.
Okay. Well, I really don't want anyone to find out. So I didn't tell my husband. He doesn't know, and I don't want him to know. I really don't want him to know. And I'm just scared that someone might be able to access the notes from this consultation. So my husband's brother works in a practice nearby, so I'm just scared that people know my husband in this area, so I'm just scared that it might get out. So
I see. Well, I can reassure you that the record of this consultation will be confidential, and even though if people talk and know your husband, the record of your medical discussion that you have with a doctor is strictly confidential, and that's not something that will be disclosed to anybody at all. Um, and the easy way that we can record the consultation today, where I can put it in a different category than the normal, where it's hidden. So only people who strictly need that information will be able to access it.
okay.
So yeah, I mean, I understand why you'd like to keep this confidential, but it's helpful to know the situation so that I can offer you the best help to treat you today.
Okay, yes. So but this is completely. I need you to be completely confidential about this. I don't want to. So the reason I don't want to tell my husband is because um, I think it's not his baby. And I think he might piece things together because he was away on tour around the time of when it happened. So yeah.
I see. Well, yeah, I can reassure you that this conversation that we're having is strictly confidential,
Okay.
and thank you very much for telling me about this. So, um, in terms of the decision to have the um, termination, there are a few things that we can discuss how you can get it done. All right. But I need to ask you a few more questions just to make sure that there's nothing else going on. Have you been having any pain in your abdomen or any pelvic pain?
No.
Any bleeding at all?
No.
Okay. And have you had any discharge at all?
No.
No. Have you had any sexually transmitted infection before?
No, I haven't. No.
Okay. And I can see on the record that you were on contraception before. Are you taking anything?
Yes. Well, I am on the pill. I'm taking microgynon, but I sometimes forget to take it. So
I see. Okay. So just to clarify, you mentioned that you think it's 9 weeks, yeah?
yeah, about 9 weeks.
Do you know exactly when was your last menstrual period it started?
Yes, so it was 8 weeks ago,
Okay.
and I'm it's usually very, very regular every 25
Hmm.
days. So yeah, so I got a pregnancy test, and it turns out it's positive.
Have you had any surgery in the past?
Yeah, I had a C-section when I had my child.
Did you have any complication?
No.
Having listened to you today, Sarah, I understand that you'd like to keep this conversation confidential and you'd like to pursue a termination of pregnancy. We can definitely discuss about the treatment. So there's various forms of termination of pregnancy. I understand that you're 9 weeks pregnant. So at this stage, we can go for a medical where that will involve you taking a medication and also might involve a pessary as well to induce a miscarriage where you might feel a bit of cramps and you might get some bleeding. And this is usually done in a clinic. So you go to a clinic and have it done there. Now, most of the time it's successful and most women don't have any problems with it. However, very rarely it can be unsuccessful, in which case some women may need to have a procedure to have it done where they need to have an operation. Okay.
Okay.
And there's also a small risk of having an infection, but in the clinic they will discuss about the risk with you and they might consider antibiotics as well. All right.
Okay. Okay, that's fine.
So it's important to have somebody who can help you to get to that clinic and then come back as well, just in case you might not be able to drive. You see.
Yeah, yeah. I spoke with my sister. She knows about it, so she will help me.
Okay, right. And the other thing I'm thinking here is that because you had unprotected sexual intercourse, it's important to consider the risk of sexually transmitted infection. I would recommend that you get checked at the sexual health clinic to make sure that you don't have an infection. You see.
Okay. Yeah. Okay, that's fine.
The last thing is about long-term contraception. I understand that microgynon is medication that you were prescribed, but there are times when you forget about it. If I may suggest, you could consider something that's most suitable, where you don't have to remember taking it. So there are other forms of contraception. Is this something that you're open to?
Yeah, I would definitely be open to it. Yeah, if it means I won't forget to take it. So yeah, just need to read more about it.
Okay. So yeah, I could offer you leaflets to read about it if you'd like. For example, there's a car, there's an implant, and you don't have to make a decision today. But if you want to read more and then you can come back when you're ready, we can discuss that. All right.
Okay, great. Yeah.
Have you got any questions about what we've discussed so far?
No, no, I just really want this to, be confidential.
Okay. So yeah, definitely I can reassure you that this discussion that we're having is strictly confidential and you don't have to worry about it because I will also put it as a priority zero, which means that even if somebody can access your notes, they won't be able to see this consultation record unless they have the authority. And then this will be hidden, you see?
Okay, that's fine. Yeah, that's okay.
All right. So I will send you the details and we'll get you referred to the clinic to have the termination. And if you do have any problem, please get in touch. For example, if you're having any bleeding pain or any issues. Okay.
Okay, that's fine. Yeah, I will do.
Thank you. Take care.
Thank you.
Bye bye. If you found this video useful, you might want to watch the next video. It's a case demonstration of a patient presenting with low mood. Click here to watch it. Take care, everybody. Bye bye.